I am very happy to introduce Dr. Robin Burry, who is an associate professor for the Faculty of Nursing at Memorial University. Dr. Burry is currently involved in a very interesting and important research project around new graduate nurses' mental health and well-being, specific to their transition during COVID-19. Hi, Dr. Burry. It's a pleasure to have you here. How are you doing today?
I'm doing very well. Thank you for having me today. I'm looking forward to this conversation.
Yes, awesome. We're so happy you could be here. Dr. Burry, can you just tell us a little bit about yourself?
Certainly. I'm a registered nurse. I have been for going on 24 years now. It's gone by in a flash. I've worked in a variety of settings in acute care, rehabilitation, long-term care, and remote northern communities as well. I've worked in administration as well as at the bedside. So I've been a clinical manager, nursing educator as well. Really, most recently, I moved to my new home province of Newfoundland and Labrador to take on a tenure track position at Memorial University in the Faculty of Nursing. So I'm very pleased to be developing my program of research focused on new graduate nurses' transition to practice and mentorship.
Excellent. Thank you, Dr. Burry. And when did you complete your PhD? I was just curious.
I completed my PhD in 2020 at my kitchen table at the beginning of the pandemic.
Interesting. That's great.
Yes.
That was interesting times, I'm sure. So, Dr. Burry, can you tell us how you became interested in new graduate nurses and their mental health?
Absolutely. So I think it really started with my own transition experience almost 24 years ago now, as I said. And at that time, very little was talked about in terms of transition to practice. And so what I was experiencing, I experienced challenges, as I know many others do during this important time of their careers. But at that time, I felt like I was the only one. And I didn't realize until many years later and I'll get into that in just a moment, but that there's a label to this. There's something that is to this, that experience. And I wanted to explore that a bit further. And so as I say, several years later, when I entered nursing professional practice in nursing recruitment, retention, and recognition, that I had an opportunity to really look into this transition experience for new graduates further, and specifically about what are the impacts on mental health and well-being for new graduates. So it was at that time, the New Graduate Guarantee Program was being implemented in Ontario. And so that's, for those of you who aren't familiar with that program, it's a mentorship program that at that time was funded by the Ministry of Health and Long-Term Care. It was titled at that time. And so I was responsible for assisting new graduates right from the recruitment phase into and through their first year of practice to transition well, I guess. And so checking in with them frequently, they would call me if they had challenges, as would the leadership at that time, meaning clinical managers and or educators in the implementation of the program or anything else related to transition to practice. And I would often get calls from new graduates at that time who were either in distress or sometimes even in tears about their transition experiences. And when I delved into it and asked further questions, really what came of that was that there was a breakdown in communication between new graduates and their assigned mentors. And so I began to wonder, why is this happening? How are we pairing new graduate nurses and mentors to form mentoring relationships? How can we support new graduates' mental health and well-being during this really critical time in their career, really? So that led me to my PhD work. And so I focused my PhD on that topic and found that there aren't best practices, so to speak, in that regard in terms of pairing, and that often mentors are voluntold to be mentors, that there is perhaps a lack of preparation for mentors and for mentees as they enter these types of relationships, and that we're not entirely sure if mentoring relationships actually occur as a result of those pairings. That people either click or they don't, and more work needs to be done in that regard to make sure that these important initiatives that we are putting in place to support new graduates' mental health and well-being and their transition to practice are resulting in what we think they are. So that's where it all started.
Wow, that's really interesting. The college has a regulatory document on transition and practice, but we
Right.
don't delve into mental health, and it's really important in today's society that we have successful. Facilitation of new nurses, novice nurses into the workplace. So
Mhm.
anyway, interesting. This is great.
And even looking back at my own transition, just thinking about, I had a mentor assigned to me. Luckily, she was fantastic, but there wasn't a lot of structure. It was just
Right.
her own natural abilities, I think, is what definitely supported me in that. But looking back on it, I don't think there was a lot of, structure and things like that. So, just caused me to reflect on my own experience there.
Absolutely. And there's
Yeah,
some fantastic mentors out there. They just
absolutely.
have that innate ability. They
Yeah.
they know how to function as mentors. They just have that those characteristics that we're looking for in terms of mentors. But I think there are a lot of other experienced nurses who could become mentors if given the appropriate guidance
Yeah.
to become mentors. So
Yeah.
yeah.
And I
Excellent.
think with the new language in the collective bargaining, contract, that, there's going to be a stipend paid to preceptors and mentors is really important, I think, to ensure that there's success with that. And that if we can identify, what it takes to have that successful mentorship and how we can facilitate the transition then into the workplace. And maybe these individuals, these new novice nurses may in the future become mentors themselves, right? So
Absolutely. And we know we've had conversations before informally in terms of um, when I've been helping mentors prepare to take on that role, I ask them to reflect on their own practice. Really take a look at yourself in the mirror and ask yourself, do I want another one of me? Because that is what you may get when you're paired with
absolutely.
a novice nurse. They look to you as an example. So you really need to ensure that you are the nurse you want to be and work with in the future.
That's
Mhm.
good insight.
Hmm. So Dr. Burry, what do we already know about registered nurses' mental health during COVID?
So in general, registered nurses have had a real challenge in terms of their mental health and well-being. A lot of literature has come out in regards to mainly the negative impacts that have occurred in terms of COVID. I'm thinking and reflecting on literature that came out regarding registered nurses in Italy, for example. We all saw that on the news in terms of the massive impact they were facing early on in COVID. And so some of that literature talks about sleep disturbances, for example, and anxiety and depression and post-traumatic stress disorders that have resulted as a result as in relation to the work that registered nurses took on during COVID, the thick of COVID, and continue to do to this day. I mean, COVID hasn't gone away, whether we label it a pandemic or not. COVID is here to stay, and we know that. And so that's why this work is so important to understand and make sure that all nurses, new graduates included, are assisted in that regard. Having said that, in terms of the mental health and well-being of registered nurses in general, we know that the result of anxiety and fatigue and burnout, as we've heard before, is higher attrition rates. Absenteeism goes up, and we know that patient safety issues are a challenge as well when nurses are their mental health and well-being is taxed. And so it's a concern, and that's why it warrants focus, right? So that's what we know at this time, and of course there are lots of factors that lend to this. We all know about the nursing shortage and increased workloads and being transferred to other areas that are unfamiliar when there are shortages, things of that nature that lend to that burden that nurses carry, and have an impact on their mental health and well-being at this time.
Yeah.
Mm-hmm.
So I know you've talked about attrition and and satisfaction and that, but is there anything is there any other reason that we should focus on graduate nurses' mental health and well-being? I know you alluded to. Do you have anything to add to that what you just spoke about?
Absolutely. So I was speaking in terms of registered nurses in general, but we know that new graduates in particular face challenges during their transition to practice. And we knew that before COVID came to be, right? Before COVID reared its made its presence known, let's say. We knew that new graduates face challenges. I mean, we've all experienced them as we transitioned. And so now we know they have a name, transition shock. Marlene Kramer brought that to light, and that was back in the 70s. However, it wasn't talked a lot about. And so Dr. Ducher's work on transition to practice, and that theory built on Kramer's and Benner's work, and she built upon that, lending her own research results to developing those models and further explaining the new graduate experience. And as I said, that was before COVID. And so knowing that the challenges of new graduates, new work environment, high and acute workloads, knowing where just equipment is on the unit where they're starting practice, et cetera, those are all stressors. So learning as you're working essentially is what is being asked of new graduates as they're transitioning to practice. Add on to that the challenges that nurses are facing with COVID, and we don't know what their experience has been like. What does that look like? What are their experiences in terms of their mental health and well-being? And so in terms of why we should focus on new graduates, though, is that for all of those reasons, and the fact that, as I said, we're facing a nursing shortage globally, right? And there's some alarming statistics in terms of shortages that are predicted. But if I can back up a moment, globally, in 2021, I believe, 80% of nurses reported mental distress in most countries. And I believe it was the ICN who predicted a 15% turnover rate due to mental traumatization, like the impacts of mental health on mental health of COVID, which would result, they were predicting between 13 and 14 million nurses short by 2030. That's a massive number, like scary number.
Yeah.
And so, simplistically, okay, hire more nurses, educate more nurses. However, we know that new graduates are the largest group of nurses from which to recruit. And so we need to focus on this cadre of nurses, this cohort of nurses, in order to make sure that they're well supported, that they transition to practice as smoothly and as are well prepared, they build resilience, because we know the literature supports that turnover rate for new graduates is still exceptionally high. I've read articles up to 57% turnover rate in the first 2 years of practice. And that was before COVID. So we need to understand what that experience has been like. We need to understand what their mental health and well-being what they are perceiving as their mental health and well-being during this time, and what supports are they asking for in terms of that transition to practice experience.
this is really interesting, and it ties in with our professionalism presentation that we do. And we talk about, having therapeutic communication, not only with the clients, but with your colleagues. And we talk about,
Mhm.
nurses, often that saying, nurses eat their young. So we try to, talk about being professional, having therapeutic communication with, these novice nurses, helping them through the transition because of the attrition rate. And as you talk about, transition shock, burnout. We want these nurses to support these nurses, and so that they don't leave the profession. So we talk a little bit about that in our professionalism presentation. So it is really nice to see where it's all tying together. So
Yes.
yeah, perfect. Thank you.
No worries.
And Dr. Berry, you just mentioned then you read in some literature up to 52%. Was
57,
that?
yes.
Oh wow, yeah, 57%. That number is that shocked me. And is that like leaving their practice setting or leaving the profession?
Both.
Wow.
Oh
So
wow.
either or both,
Yeah.
yes.
Wow. Yeah.
Yeah.
Yeah. Yeah. So
So it's
very, very
concerning.
important. Yes, absolutely.
If those
Can,
aren't actual numbers, I don't know what are, right?
yeah.
Yeah.
Yeah. So what is the study that you are conducting at the moment for this topic right now at the moment? Like, what is the, I guess, the research question that you are trying to answer?
Certainly. So right now and I say we because there's a team, of course. I am a co-PI on this study along with Dr. April Pike and our team members, Dr. Madigan, Dr. Rahman, and Dr. Vernon Curran from Education and Medicine at Memorial as well. And so what we are focused on is understanding the new graduate nurse experience and perceptions of their mental health and well-being as they transition to practice during COVID. And so that is really the crux of the matter. We want to understand that experience. We also want to understand what resources they're aware of and which resources they're using and what supports they're asking for. And so that's really the overarching question and the objectives in together. So
Uh,
yes.
yeah, that's a very interesting topic, and yeah, and that is the only way that we'll be able to support the new graduates if we really have an understanding of their experience. So yeah, yeah, very interesting.
Yeah.
So we're conducting this research doing an interpretive description study, conducting semi-structured interviews with new graduates who graduated between 2020 and 2021. We completed 16 interviews and have a few follow-up interviews to finish up. And so the conversations have been very rich, and I'm confident we're getting a really good understanding of what these new graduates have experienced during this time and how we might be able to support and highlight their voice in terms of what supports they require. Mm-hmm.
Excellent.
So, Dr. Burry, were you able to receive funding for this study? Because it seems such an important, field of study by the conversation we're having today.
Yes, we're very fortunate to receive financial support from Workplace NL for this work.
Oh,
And so, yes, they were very interested in understanding the experience of new graduate nurses during that time. And they also wanted to look at the medical residents as well. And so there was a study that was being done in tandem. So, and Dr. Curran was working on that as well. So.
very good.
Mhm.
Excellent. Well, I'm very glad that you were able to secure funding for this. This is so
Yes,
important work that you're doing.
thank you.
Absolutely. And have you had much interest in this study?
Yes, we've been approached by several groups in terms of wanting to hear about the results, and we're in the analysis phase of looking at the results of the interviews at this time. Um, but in terms of recruitment, that is where it's been really interesting. We knew or we anticipated we might have some challenges in terms of recruitment for the study for multiple reasons. And in fact, we did have challenges in terms of recruitment. I get the sense that, it may have been the topic itself. Perhaps people didn't want to talk about their mental health and well-being at this time, right? Maybe it was just they didn't want to go there. Or perhaps it was about workload and working overtime, perhaps, or maybe they were fatigued, or maybe it was the way they were feeling at the time. They weren't ready to talk or able to talk. So we ran into some challenges in that regard, but I think 16 interviews is a good good starting point anyway, in terms of getting a good baseline understanding within Newfoundland and Labrador, and being able to think about how we can do things differently in the future as a result of this.
So,
Yeah,
Dr. So go ahead,
sorry,
Kelly.
no, go ahead. No, I was going to say that's interesting. And 16, I mean, for qualitative research is such as this. I mean, yeah, that's fantastic. Yeah.
So, Dr. Burry, you talked about you're done some initial analysis in that. So, what are the findings or results that you're finding in this study when you're with your initial analysis?
Certainly. So we can't present the themes as of yet. As I say, we're still in the analysis phase. But as a colleague of mine likes to say, we can share some initial impressions, right? And so what's been really interesting to see is that educational supports, personal supports, and workplace supports were really important to this group. Education supports, meaning that many who had completed their final placements in the same area where they began work, they felt it was easier for them in terms of transition, even during in COVID. Or if they had worked there as a PCA, as an example, that made it a bit easier for them. In terms of personal supports, feeling like if they had a good family or friend network, even during COVID, even though you couldn't necessarily be together all the time, having that connection was really important for them outside of work, and developing their own coping strategies, which I'll get into in just a moment. Additionally, work supports, feeling like your colleagues were there for you and checking in on you, even if they weren't right beside you, paired, let's say, in that regard, but knowing that they had your back was important to new graduates, as they put it. So that was really positive in terms of what those findings were. Some felt that that experience transitioning to practice, being put through such a challenging time right from the get-go, they felt that if they could get through that, they could get through anything, which was lovely. Others faced challenges that really mimicked what we talked about initially in terms of registered nurses, that fear, anxiety, specifically related to becoming infected themselves or infecting others, learning about PPE, donning and doffing, and really making sure that they were doing it accurately and speedily. And then on top of that, they talked about, so we had to do it all at once. We had to do that. And then we had to still learn where everything was on the unit, and, take on extra workload because of staffing shortages. That came up a lot in terms of the shortages. And the impact on workplace culture as a result of staffing shortages was often talked about. Some had some, how can I put this? We talked about that reaffirming of their career choice for some of them. Others, we talked about nurses eating their young. Some experienced nurses were actually questioning them why they went into nursing in the first place, which was really alarming to hear. And I think it's probably reflective. I mean, this is my own personal thoughts on it. Again, we're ruminating on this and wondering about this. I wonder if some of those results have to, or findings or experiences are related to how those experienced nurses were feeling at the time, rather than reflective of those new graduates themselves, right? And so, the question then becomes, how do you bolster new graduates' confidence to be able to manage those comments when they come?
Yep.
So that's something to think about. In terms of, they talked about education and orientation and how sometimes their orientation was cut short due to staffing needs on the unit. And so that was really interesting to think about, and something to work on in terms of outcomes for the future. We're not talking about necessarily cutting short resulting in safety challenges necessarily, but in terms of a fulsome orientation where people are leaving feeling super prepared and ready to take on anything, that wasn't necessarily the feeling when they left their orientation. So those were some of the findings. What I found interesting was that some of the coping strategies that new graduates tended to lean towards, such as physical activity, were extremely challenging to be able to engage in during the thick of COVID, I'll call it. Because as we said, COVID's still around. we haven't been able to put that behind us necessarily, but during the thick of it, when lockdown was in place, they couldn't get to the gym because the gyms were closed. And so their main coping mechanism was no longer available to them. So, and we know that physical activity is so important, in getting those endorphins up and making us feel better, getting those muscles worked out, et cetera, and really just keeping fit to be able to function and physically work as a registered nurse. And so, as I say, those coping mechanisms were not available. So they also found that the fatigue that they were feeling at that time prevented them from engaging in activities such as walks and going for an outdoor run or something like that. So there was a push-pull there in terms of, I want to be present, I want to be at work, I want to support my colleagues, but I'm so tired. And they did talk about that learning while you're working experience and how that impacted fatigue. And so that's a bit of a warning sign to us, because we know fatigue is sort of the beginning of that trajectory towards burnout. And so how do you manage that? So that was one of the wonderings. As they say, we're not finished in terms of the analysis, but those are some initial thoughts that we've come across. And so it's not all doom and gloom, I want to say, but there are certainly some areas upon which we can build. And I would say that it was interesting that several people who spoke with us were taking advantage of several of the resources that are available to them, such as EFAP. But what was interesting is that they found that the hours that were available were not enough to support what they felt they needed. And so that was also, I would imagine that's probably not a surprising finding, but interesting that they remarked on it, and that they are taking advantage of the resources such as that were available to them.
Yeah.
Debriefing was another one that came up, that they thought would be beneficial. And it was interesting because we know that debriefing is really beneficial for critical situations. But during COVID, when you're facing such, especially on units where you had or new graduates were caring for many people with COVID, they were facing some very challenging situations on a regular basis. And so when could you implement debriefing exercises? How can you fit that in when you're working nonstop, when there are shortages? But then there's also the conversation about what kind of debriefing is taking place, because we know there are lots of different kinds, and that is it about the process, or is it about how you're feeling about what happened? And so I think there was a tendency, at least from new graduates' perspective, to view them more um, as a process debriefing, as opposed to working through some of the emotions that they were feeling. And so there might be some opportunities there. But as I say, we're delving into the the thick of it now, and so I'm excited to see what will come of it. But
Absolutely.
It's very,
mhm,
very interesting findings there. And just going back to when you were talking about orientation, you
yeah,
know, when I orientated, it was all in person. I had that luxury. During
mhm,
COVID, a lot of things were online, and that's a big adjustment. Some people, they may not learn as well like that. Maybe in person, they will be able to take in that material a little bit easier and feel more supported, I guess, in person. And even thinking about the socialization in the beginning, during COVID, you didn't really break together, right? You would
exactly.
be by yourself mostly, just to limit that interaction, with your masks off and those sorts of things. So I'm sure that probably, I'm just thinking, you might not find it in your findings, but just thinking that
No,
must have had some sort of impact, right, on these new grads at that time.
absolutely. And uh, we know that uh, just in general, PPE, wearing masks, very difficult to
Hmm.
socialize, both physically, that social distancing that was required, add on a layer of PPE on both sides. And I know even for myself, when I first moved here in 2021, I actually had to go through an entire reorientation in terms of getting to know my colleagues, because I couldn't recognize anybody without their masks. When that was dropped, I couldn't, even though we met online and I saw their faces online, I really had a hard time. And so I started thinking about, wow, what about on the unit? What about these new graduates who are meeting and trying to socialize? And we know you raised an excellent point, Kelly, in terms of socialization, especially for new graduates. We know in terms of that turnover rate, that high turnover rate, we know one of the largest reasons for people to leave, specifically new graduates, is a lack of socialization or a feeling that they don't fit in. So, how are these new graduates socializing with all these layers of PPE, not being able to have their lunches together? And if they are, it's going to be with one person, or, you know, being so exhausted they don't have time or a desire to talk, right? It's I think that is something that really needs to be delved into much more. We're just scratching the surface in that regard.
Is it interesting that you talked about the mask? I was a manager of an OR, and for many months, like you're in the OR and all the nurses are wearing their mask. And one day, one of the nurses from the OR walked past me and said hello without a mask on, and they were getting ready to go home, and I didn't know who it was. So
Right.
that was kind of, yeah, that was kind of interesting. Um, I just participated in a working group from the think tank that the RNUL and the provincial government worked on for looking at mental health of registered nurses. And we done
Yes.
a survey through that mental health working group, and a lot of the findings that you've talked about debriefing and EFAP not being enough hours. Those are some of the results that we got from our survey of
Yes.
registered nurses as well. So it was really really interesting as you were talking. I'm thinking, okay, and even though there were debriefing services in the
Mhm.
NLHS, or there's different zones at that time, the different RHAs. people weren't availing of them. And with having COVID and the pandemic on that, getting access to those services were much more challenging. And I guess even going back to when it first started, and I can't even imagine novice nurses, new nurses, graduate nurses starting. And there was such a fear about COVID because we knew so little about it. So adding on that expectation of, graduating from their nursing program, going into a new unit, and taking that on, and then living through COVID and not knowing what the end result would be or what this, virus was really about. So it must have been truly very difficult and challenging for graduate nurses. So I'm so glad that you're undertaking this study.
Thank you. It's interesting that I so appreciate your comment in terms of the OR and that likening to not recognizing someone in the hallway. That I think that's a wonderful example outside of COVID, right? That
Yeah.
It's true. We don't recognize each other when those masks come off.
Yeah.
But in terms of that transition experience, you're making me think about some of the new graduates remarking on the fact that new nurses who graduated during COVID, they felt that they were a different kind of nurse.
Interesting.
Yeah. That
In what
was
way?
talked about in different ways. So they talked about being different in terms of how they were prepared to be a nurse, things going online, that clinical experience, or sometimes having to switch to a simulated experience versus an in-person clinical experience, at least initially. And then in terms of that orientation, Kelly, as you were speaking about, in terms of being online versus in person, and how do you connect with people? And so they were left wondering about, I think it creates another layer. And again, this is just a reflection that I'm having in the moment. I think it creates another layer of othering, right? That they are somehow different than others because of this relatively unique experience. And so again, there's more and more work to be done in this regard in terms of research, but it's fascinating when you delve into this. You come up with more and more questions that need to be answered. So this type of research, as with many others, you never walk away with a nice clean red bow at the end that everything's tied up nicely, but finding that there's a lot more work to be done.
Mm-hmm. Absolutely. That's the thing about research. Hey, you'll answer one question, but you'll get 20 more.
Exactly.
So, Dr. Burry, when do you anticipate that this study will be completed?
So this study we're anticipating will be completed in March of 2024. So we're wrapping things up now. And so we're excited to finish this and report finally on the findings once they're completed, and look forward to presenting our final report to Workplace NL as well. Mm-hmm.
Excellent.
So you said you were sharing your results with Workplace NL. Are you planning on sharing them with anyone else?
Absolutely. So we're very much hoping to be able to share our results with NL Health Services, of course, so that they can hear the voice of new graduates transitioning practice in the province, and hear what new graduates are hoping to see in terms of supportive practice, and just engage in that conversation. Hopefully, look to the future as well in terms of how we can support any additional resources that are required. We also have an abstract that's been accepted in Washington, D.C. for Sigma Theta Tau. It's a conference that is focused on healthy work environments. So we're really excited to be able to share the results there in 2024. And of course, we're hoping to be able to publish works on this as well. So more to come for sure.
Absolutely. Can't wait to read the final document, the final published paper, and hear the results. So, and
Yes.
and maybe it will give us some some data also to look at our transition to practice document, and maybe there's things in that document that we may need to update or reflect on, in what your findings show. So that's exciting for us as well.
Absolutely. I think that would be a wonderful opportunity to collaborate and really put findings of research into practice.
Absolutely. Great. Thank you. I'm sure we'll be touching base.
Absolutely. I welcome that. Yes.
So, Dr. Burry, what are the next steps for this project?
So, yes. So we're excited to, as I say, present the results, of course, as we've just mentioned, but also start working on those resources. So once we understand fully what new graduates are looking for, we really want to be practical in terms of the approach and start developing and evaluating resources that are put into place, hopefully, and work in collaboration with NL Health Services in that regard. So I'm looking forward to those conversations coming up, hopefully in the new year. And then also in terms of continuing research, just received funding for another study looking at transition to practice of nurses in general to family health teams in Newfoundland and Labrador. So that'll be exciting. And then also we would like to look at the transition experience of internationally educated nurses as well, and really see how we can support, and recruiting is one thing, but retaining is another, and making sure that nurses who are entering our healthcare system are well supported, that they're in good health, both mentally and physically, and that they stay and are successful and happy in their careers moving forward. And so we know there's a lot of work to be done, but that's exciting. I think we can make a positive contribution. So
Sounds exciting.
yes.
That's very exciting. I just want to make sure that I'm clear. This study was limited to new registered nurses, right?
Correct.
Okay.
And just in Newfoundland and Labrador as well.
Just in Newfoundland and Labrador. That's right. And I know you mentioned nurses. You said future research, maybe nurses in general. Did you
Yes.
Specific to what? Nurses in general, as in, would you include LPNs there, or yeah?
Absolutely. There's an
Okay, yeah.
opportunity for that. We initially thought RNs in general, because of the work that's already been done in that regard, and so translating that to other areas of practice would be important. But certainly, looking at transition to practice experiences of LPN, that is an important area to look at as well. And so that certainly isn't off the table.
No, that's right. And I guess, yeah, I'm just thinking about nurse practitioners as well. They probably have their unique challenges and things. Yeah.
Yes, especially when we're talking about family health teams as well. So Dr. Lukowicz is co-PI of that study that I was just mentioning that we've just received funding for. And so she's done incredible work in primary care settings, of course. And so I think knowing that there are many different nurses who work in family health teams, nurse practitioners, RNs, and LPNs alike. I think there's space for understanding all of their transition to practice experiences. Absolutely.
Yeah, particularly I think where we work within collaborative teams and the family care teams being one example. But I mean, we don't work in isolation, do we? Like, a new grad coming to the unit, we're working with other healthcare professionals and other disciplines of nursing. So it really affects that collaborative relationship if one group is struggling and experiencing burnout or having challenges. So it's really important that we understand what our colleagues are going through. I think, as we always say, you need to know the scope of practice of who we work with, but I think we need to understand our relationships with each other and how we collaborate and how we communicate with each other. So
and how we can support each other.
Absolutely, for
So those
sure. Yes.
debriefing exercises, I think, might be really important, especially in an interprofessional approach to debriefing. So
Yeah, absolutely.
I just want to say thank you again, Dr. Burry. That the research that you talked about was very interesting, very enlightening for myself, and I'm sure for Michelle as well.
Absolutely.
Yeah, thank you so much for
Thank you.
being
It's
here
been a
today.
great conversation. It's gone by very quickly.